What if I told you there's one natural food that can lower your blood sugar, boost insulin sensitivity, reduce cravings, and even protect your heart and kidneys? And no, it's not some overpriced health trend or rare Himalayan root. It's something ancient, affordable, and completely backed by science. Welcome to Health Pulse Haven. Today, I'm revealing the #1 superfood for diabetes that most people overlook. Stick around because not only will you discover this superfood, but I'll also show you how to use it, what science says, and the 3 foods you must avoid if you want real results. Let's break it down. Type 2 diabetes affects over 400 million people worldwide. The core issue? Insulin resistance. Your body can't use insulin effectively, so glucose builds up in the blood. Now, most superfood lists just throw random items together: blueberries, spinach, cinnamon, chia seeds. But here's the thing, not all superfoods are created equal. A true superfood for diabetes must check 3 boxes. Low glycemic index, doesn't spike your blood sugar. High in fiber and micronutrients, slows digestion and improves insulin action. Clinically proven, backed by peer-reviewed studies. And guess what? Today's pick ticks all 3. Let's start with the popular options. Chia seeds, great fiber content, omega-3s, but they're not easy to digest for everyone and may cause bloating. Cinnamon, studies show it may reduce fasting blood glucose by 10 to 29%, but only in very high doses, and quality matters. Bitter melon, powerful but bitter taste, hard to find fresh, and can lower sugar too much in combination with medications. Apple cider vinegar, yes, it helps, but works best as a support, not a core food. And that brings us to today's star. Fenugreek seeds. Yes, those tiny yellowish seeds you've probably seen in Indian grocery stores. They've been used for thousands of years in Ayurveda and traditional Chinese medicine, but now modern science is finally catching up. Let's look at the data. A study published in the Journal of Diabetes and Metabolic Disorders followed 60 patients with type 2 diabetes who consumed fenugreek seeds daily for 12 weeks. The results? Fasting blood sugar dropped by up to 25%. But that's not all. Their HbA1c, the 3-month average of blood sugar, also decreased significantly. That's the kind of number doctors pay attention to. Another meta-analysis of 12 trials found that fenugreek improves glucose metabolism, insulin sensitivity, and even lipid profiles, meaning it lowers bad cholesterol and triglycerides, both of which are common complications in diabetics. Now let's talk biochemistry. What's in fenugreek that makes it so effective? First, galactomannan, a type of soluble fiber, slows down carbohydrate digestion and absorption. Second, an amino acid called 4-hydroxyisoleucine stimulates insulin secretion and enhances insulin sensitivity, especially important if your pancreas is overworked. Third, fenugreek contains powerful antioxidants that reduce inflammation, which is often the silent driver behind insulin resistance, weight gain, and even heart disease. Now let's take a deeper look at the side effects and precautions. Some users report digestive issues when they start, like gas or bloating. That's usually a sign to reduce the dose or shift to a powdered or sprouted form. And remember, fenugreek lowers blood sugar. If you're already taking medication like metformin or insulin, you must monitor your glucose levels to avoid hypoglycemia. Always talk to your doctor before adding it. Also, pregnant women should avoid fenugreek unless prescribed. In high amounts, it may stimulate uterine contractions. Now let's crush a few myths that often confuse people. Myth number 1, superfoods cure diabetes. False. No single food can replace medication or an overall healthy lifestyle. Fenugreek is powerful, but it's part of the puzzle, not the whole picture. Myth number 2, natural means safe. Nope. Natural foods can still interact with medications or cause side effects. Just like with supplements, dosage and timing matter. Myth number 3, if a little is good, more is better. Actually, no. Going overboard on fenugreek can cause digestive distress or dangerously low blood sugar. Start slow and build up. So how do you actually consume it? Option 1, soaked seeds. Take 1 teaspoon of whole fenugreek seeds, soak them in a glass of water overnight. In the morning, drink the water and chew the seeds on an empty stomach. Start with half a teaspoon if you're new to it. Option 2. Powdered form. Roast the seeds lightly, grind them into a powder. Take half a teaspoon in warm water or mix with yogurt before meals. You can also add this to your lentils or soups. Option 3. Sprouted seeds. Soak, then leave to sprout for 2 days. Add to salads. This method increases nutrient bioavailability and reduces bitterness. Let me share a story. One of our neighbors, Robert, a 52-year-old schoolteacher, has been living with diabetes and taking 2 medications. He's also been trying every trending food, chia seeds, apple cider vinegar, even expensive supplements. When he started incorporating soaked fenugreek seeds every morning and cut out his flavored yogurts and cereal bars, he saw his fasting sugar drop by 20 points within 3 weeks. Yes, 3 weeks. And the best part? He felt more energy, less brain fog, and his cravings reduced. Now, imagine the ripple effect of that one small change. Let's address another common issue. Many so-called healthy foods marketed to diabetics are actually harming them. Here are 3 of the worst offenders. 1. Flavored yogurt. Even low-fat or probiotic-rich yogurts can have 15–20 g of added sugars per cup. Always go for plain, unsweetened Greek yogurt. 2. Granola bars. Most of them are glorified candy bars, full of refined oats, honey, and dried fruits. Your blood sugar spikes within 30 minutes. 3. Whole wheat bread. Sounds innocent, right? But many brands sneak in high-fructose corn syrup, sugar, and refined flour. Try low-carb bread or simply swap in more vegetables. Quick FAQ time. Question: can I take fenugreek if I'm on insulin? Yes, but only under your doctor's supervision. Start small and monitor sugar levels. Question: is fenugreek safe long-term? For most people, yes. In fact, it's a traditional food in many cultures. Just avoid overuse. Question: can it help with weight loss too? Definitely. Fenugreek reduces appetite and supports blood sugar stability, both of which help manage weight. Question: will it work for prediabetes too? Absolutely. That's the best time to start, before things get worse. Bonus tips before you go. Pair fenugreek with a 10-minute post-meal walk to enhance insulin sensitivity. Drink cinnamon tea in the evening. It pairs well with fenugreek and helps lower sugar overnight. Focus on sleep. Poor sleep increases cortisol and insulin resistance, undoing all your hard work. Hydration matters. Fenugreek is high in fiber, so drink enough water to avoid bloating. Let's bring it all together. If you're managing diabetes or prediabetes, the #1 science-backed superfood you should start with is fenugreek seeds. They're affordable, accessible, and most importantly, effective. You don't need to overhaul your entire diet overnight, but consistent, smart changes like this can transform your health. If you found this helpful, go ahead and smash that like button. It helps others discover this life-changing information. And if you want more science-backed strategies to take control of your health, hit that subscribe button and turn on the bell for notifications. Got questions about fenugreek or want us to break down other superfoods? Drop it in the comments below. I reply to as many as I can. Thanks for watching. Stay curious, stay consistent, and as always, stay healthy.